It is an honor to welcome you to this official side event of the 78th World Health Assembly. On behalf of the co-organizers, PATH, the Government of South Africa, the Gates Foundation, and the World Economic Forum's Global Alliance for Women's Health, I thank you for joining us at this timely and important discussion. We're here today because women's health continues to be systematically undervalued in global health, both in research and in policy. Despite making up half of the world's population, women receive only a fraction of the research investments. Just 7% of healthcare research is focused on conditions that exclusively affect women. And women, particularly women of color, older women and women living in low-resource settings remain underrepresented in clinical trials. This is not simply a research gap. It is a systematic failure that undermines our progress towards universal health coverage, equity, and resilient healthcare systems. Over the past year, the Global Alliance for Women's Health has brought together more than 45 organizations, including PATH, to coordinate a white paper that lays out 5 policy levers to transform the ecosystem for women's health, science, and innovation. These levers focus on investment, inclusion, sex-disaggregated data, clinical trials with women and girls in mind, and really deepening our sex-specific insights. There are the building blocks for a stronger, fairer system, but progress will depend on how well we align policy, financing, and delivery to turn evidence into impact. This work must also be grounded on global commitments, including the Sustainable Development Goals, in particular SDG 3, and the Global Strategies for Women, Adolescents, and Children's Health, the 2016 to 2030, which highlights the need for policy leadership in prioritizing women's health. Cervical cancer offers a really clear case study of what is possible when that alignment exists. It is one of the most preventable and treatable cancers, yet it remains a leading cause of cancer-related death in women in low and middle-income countries. It's not because of a lack of science. There are highly effective HPV vaccines, screening tools, and diagnostics. What has made a difference where progress is being made is the alignment around innovation, policy, and access. This issue has rightly received renewed political attention, including through the WHA resolution championed by South Africa and other member states this week that really reinforces the importance of cervical cancer elimination as a global priority. The launch of this white paper and the discussions we are having today come at a critical moment. Under South Africa's leadership of the G20, we have a unique window to push for reform that place women's health where it belongs, at the heart of national policies, policy agendas, and global development frameworks. Let me take the opportunity to acknowledge and thank the co-organizers and speakers, the Ministry of Health for South Africa, for their leadership, Amira Guabi, who is the World Economic Forum and stewardship that has been brought, and our esteemed colleagues from Merck, the Wellcome Trust, the Ministry of Health from Kenya, and the Gates Foundation for their partnership. We have the evidence, we have the partnership, and we have the momentum. Now we need the political will to match this. Let us use this moment to commit not to just to better science, but to better systems that ensure every woman everywhere can benefit from the innovations we develop. Thank you. So we will start off by keynote speakers. I'd like to start off by introducing Amira Guabi. Amira is the head of the Global Alliance for Women's Health at the World Economic Forum. And Amira brings deep insights into multilateral partnerships that drive systems changes, and has been instrumental in convening a year-long collaborative process to shape this white paper. Over to you, Amira.
As we gather here, we are reminded of the importance of collaboration and the power of multi-stakeholder approach in addressing the challenges and opportunities of our time. The Global Alliance for Women's Health, launched in January 2024 and hosted at the World Economic Forum, is a leading multi-stakeholder organization and platform to address systemic challenges that contribute to the women's health gap. And we know that women spend 25% of their lives in poor health due to the root causes of the women's health gap, which are the funding gap, the care delivery gap, the data gap, and the research gap. We also know that closing the women's health gap is a $1 trillion opportunity every year, with a potential to help 3.9 women living healthier. And today, the Global Alliance for Women's Health, in collaboration with our knowledge partner, Kearney, and the chair of the Alliance, the Gates Foundation, as well as the Plus 40 organizations who contributed to make this happen, I'm delighted, as mentioned, to announce the launch of a new white paper, Prescription for Change, Policy Recommendation for Women's Health Research. This paper aims at sharing policy changes that need to happen to make a robust, safe, and inclusive approach to women's health science and innovation. And we strongly believe that driving innovation in women's health can improve the statistics and lead to more women-focused clinical research. In addition, by introducing policies that promote the inclusion of women across diverse racial, ethnic, and age groups in clinical trials, we can make sure that clinical trials better reflect the population they aim to serve. Now, the key question is, why is it urgent for us to address the research gap in women's health? The information that shapes medicine today and what is considered effective treatment for various conditions affecting women is mainly based on male biology. Yet, globally, more women than men receive clinical care. And that's really the issue here at the heart of women's health research. Despite higher healthcare usage, women's unique health needs remain underfunded, under-researched, and therefore under-addressed. Giving you examples, only 7% of healthcare research is invested in conditions that affect women only. Only 5% of medication have been adequately monitored, tested, and labeled with safety information for use in pregnant and breastfeeding women, only 5%. And these disparities have many implications, influencing diagnosis, treatments, and ultimately health outcomes for women. It also undermines progress towards human biology, female biology, and global developments. And we see that, addressing the women's health gap is not just a moral imperative. It's also a critical step towards more robust science and better health outcomes for all. Now, the other question is, how do we address the gap? What policy recommendation or changes should happen? And the paper, and you all have a leaflet on the table so that you can have access to our paper, it outlines 5 key recommendations for safer and more effective research. The first recommendation is to unlock innovation in women's health and promote more inclusive approaches to clinical research, making sure that trials more accurately reflect the women they are intended to serve. The second recommendation is the expansion and the inclusion of women in clinical trials. To make sure that new treatments are safe and effective for women, it is crucial to increase their participation in clinical trials, especially around early trials in key areas such as cardiology and oncology. And also include often excluded groups such as women of color and postmenopausal women. The next recommendation that's outlined in the paper is to enhance the disaggregation of clinical trial data. Improving data disaggregation in women's health will require a series of thoughtful and coordinated steps. And the first step is very clear. We must harmonize our terminology and agree on data standardization and collect practices. Ideally, we do that in collaboration with key institutions such as ICH. And of course, this will only be possible with cooperation and coordinated efforts between industry players, regulators, key stakeholders, and non-for-profit organizations. The next recommendation that we are sharing is to design clinical trials with women in mind. And we propose to employ sex-specific biomarkers and to design clinical trials to account for sex-based differences in physiological mechanism and manifestation. Education and access are critical not only to uphold ethical standards and ensure informed consent, but also promote inclusivity in clinical trials, which is essential to advance medical research. And the last recommendation is to deepen insights on sex-specific differences. And here we have two quick wins to implement. The first one is to increase awareness among scientific journal editors on the importance of reporting sex-disaggregated data, and include sex-specific insights in clinical guidelines and product information to make sure, again, that safe and effective treatments are available for all patients. Now, to close my remarks, we know this kind of change is possible, and we've seen over the last 2 decades significant progress in different areas such as rare disease and in pediatrics, where targeted interventions and incentives have transformed outcomes. The time has come to bring the same ambition into women's health. We believe that advancing women's health research is essential to strengthening the quality and integrity of medical science. When we close the gap in research and clinical trials, we deepen our understanding in human biology and improve health outcomes for everyone. The Global Alliance for Women's Health, Kearney, and our partners have promoted policies that can drive robust, evidence-based innovation. Better science leads to better solutions, and making sure a healthier future is available for all patients everywhere. Thank you.
Thank you, Amira, and I strongly recommend you read the paper. I think the evidence in there is very compelling, and as Amira, I'm a great believer in action from everybody, and as Amira has pointed out, I think it's very action-orientated. There are some quick wins that we can all think about in the way that we move forward, so thank you for that very nice presentation. We do have a second keynote speaker from the government of South Africa. This is Dr. Nonsense Makanaya. Unfortunately, as I'm sure you can imagine, the government of South Africa are in great demand, and unfortunately she is running late. But we would obviously like to leave some time for her when she comes later to be able to give her keynote speech and really on the importance of political leadership. So with that in mind, I think we should probably at this point move on to the panel. So I can hand over the baton to my partner in crime for the meeting. So to guide the panel discussion, I'm really honored to hand over to Dr. Catharina Boehm, who is the Assistant Director General for External Relations and Governance at the WHO. So she brings extensive experience shaping global health governance, financing, and multi-sectorial partnerships. And she served in several roles in leadership in WHO and other organizations, and really has the ability to both navigate political and technical dimensions of public health. So over to you, Katharina.
You know, I think we all know why we are here. We're here to close the gap in women's health, and we're here to make sure that all of us have equitable access to evidence-based healthcare. You know, I must say I notice a slight gender imbalance here in the room. And I joked about it with my colleague Søren, who happens to be one of the handful male I see here. And so, you know, I want to thank all of you for having sacrificed your lunch break for this important topic, and want to say we need females and males equally to champion this important topic. So let's make sure we don't lose the man behind. And then I want to quickly thank PATH for hosting us. You know, this is great and a topic that I feel is not enough served this year at the World Health Assembly. So really, really grateful. And then to the World Economic Forum for, you know, like bringing so many champions around this important topic. And I'm myself a member of the Global Alliance for Women's Health, and, you know, have learned a lot and really appreciated having the platform to champion this topic. So with this, let's dive right in. You know, we heard the recommendations in the important white paper. I have a range of distinguished speakers here with me who will discuss with us how to operationalize the white paper's recommendations, how to align investment and the delivery ecosystem around it, and then also, last not least, how can we seize the momentum of the World Health Assembly, of the G20, to drive lasting change in this area. So before diving in, let me super quickly introduce my panelists, starting on my right, your left. We have with us Dr. Christine Meyer-Nicolai, a fellow German, Vice President for Global Regulatory and Scientific Policy at Merck, and brings extensive background in regulatory and also policy, global policy science. So will be a very interesting perspective. Then to her left, Dr. Charlotte Watts. We know each other from FCDO in the UK government, but Charlotte is now executive director for solutions at the Wellcome Trust, a close partner to the World Health Organization. And her background spanning research, government, and policy, and her expertise in infectious diseases, climate, and mental health, I think will also bring very interesting perspectives. Then we have with us Dr. Mary Mutoni Muriuki, Principal Secretary for Public Health and Professional Standards at Kenya's Ministry of Health, you know, and, you know, really bringing deep expertise in terms of national public health strategies and policy making. South Africa still hopefully to join us. Then here to my left, we've recently been together on another panel, Dr. Sanjana Bardwaj, Deputy Director Program Advocacy and Communications at the Gates Foundation, You're a medical doctor by background and leads policy and advocacy work in family planning and but also much more broader, right? Maternal and child health, etc. So again, a different perspective, different angle. And Melanie, CSO from PATH, and again, physician, virologist, huge expertise in vaccination development and product development and innovation. So I think with these panelists, hopefully we'll be able to cover a broad range of topics. And so let me perhaps turn first to Charlotte and then Melanie with my first question to all of you. What are the most effective pathways to move from policy recommendations to tangible action at national and global level? And what are the risks of failing to act now? So Charlotte, I hope I'm not surprising you too much with this question, but over to you.
No, it's a pleasure. And I mean, just some reflections. I've spent the last 9.5 years in government in the UK in the Foreign Affairs FCDO, advising ministers and trying to bring science and informing them of the possibilities of science. And so just to home in on and think about if there was a particular recommendation I was taking it to a minister, the sorts of conversations I would be having is just basically talking about its relevance to their ambition and to the government's ambition. So a recommendation that is way out and is not aligned with actually what a government or what a minister is trying to achieve won't get the attention. But if you can create that connection to priorities, that's how you get in the door, how you might even have a conversation to start with. Mm-hmm. I think the second is there are many things that decision makers get asked to do. They can't do everything. So you have to be talking about actually why this is a priority and what does it mean in practice? Because often it's, can you really do this? Right? And can you do this within the budgetary constraints? Can you do with the systems that you've got? Can you do this? What might be the implications for people or so on? So that practicality is an important consideration. Mm-hmm. And then the other element is, well, what might be the benefit, but also might be the costs? And it's not enough to say, well, this would be highly cost effective, because there's lots of things that might be cost effective, but we can't afford them. Mm-hmm. So it would really be talking about very tangibly what this might mean. Does this deliver a saving? Does this improve a service? Does this mean we can do something more quickly? And it's the big figures, that 7% figure is really powerful at an international level, or the economic return. But actually, if I think about the conversations that will happen within a government, it's much more domestically, what does that mean? And then part of that conversation is what are the implications of inaction? And some of the implications of interaction might be linked to women's health. It might be linked to what's it mean for women's ability to be part of the workforce, to the sort of economic sort of benefits, the case of what's the issue if we don't do this will be very, very, the issue will be to highlight what's most salient for the priorities then of that government.
Obviously, with this paper, the gaps that are there, I think, have been very nicely articulated, and also the policy levers really grounded in evidence. So that really gives us something very nice to work with. In terms of national systems, I think all of those key elements Charlotte mentioned, it's about health, it's about science and technology, it's about financing, and they actually all have to come together within the government. So it's really thinking about how each of the governments can think of a whole government approach to this, but obviously pulling all of those pieces together to make advances in innovation and access to women. I think the second important enabler really is using events like this. So to move from policy recommendations, we're here talking at the World Health Assembly. We have the G20 with the South African presidency that can continue the discussion. We've got UNGA coming up as well. So how can we use those events really to lock in commitments from the governments, whether that's declarations, some commitments to investments here, or frameworks and roadmaps to really get to achieve the goals that we're looking for. Clearly, without this action, we will maintain the status quo, where women are really left behind.
So that's very important and leads me to my next question to Christine and Sanjana. So Christine, or Christine, how we say in German, how can we unlock innovation in underfunded areas of women's health while also building the system-wide capacity that we need to deliver the solutions then in an equitable way and drive access to those innovations?
I wanted to add just a couple of words. Why am I here as an industry representative, right? I want to say we are involved as a company very much in, for example, infertility treatment or other autoimmune diseases that affect women disproportionately. So our interest is to involve women in clinical trials and in other activities because we want to develop drugs or medicines that work for the population that we will be treating. So this is our interest. Now, I was introduced as someone with background in regulatory. For me, or in industry, that means regulatory affairs, how to get the products approved and how to get the clinical trials approved, first of all, to really substantiate that they are efficient. And the policy work that I do is about how to create frameworks, discussing, of course, with other stakeholders, like in the nice white paper that we have launched today. How can we create frameworks that support the work that industry is doing and also other stakeholders? Because we're not the only ones running clinical trials. There are a lot of investigator-sponsored trials, but they all have to follow the same regulatory requirements. And this is where, of course, the innovation happens, right? We need to first do research that has to be publicly funded, most of it. And then it's developed, on the basis of the research, the compounds are developed and then brought to the patients through clinical research, most of the times by industry. Not always, but this is where we, have an important role to play. And we are, happily a regulated industry, but let's regulate in a way so that it's useful for patients and gets, the medicines to the patients. The innovation can be supported in many ways. The ecosystem was mentioned by many colleagues already. So we have to take an ecosystem or system approach to it, starting from funding of the research, then, of course, looking at important stakeholders like healthcare professionals and patients. Educational measures were mentioned, but also, of course, on our side, on the sponsor side, doing the right thing, getting the right data in place, and supporting global harmonization. So ICH is an important area for us, and for example, there's ICH E6R3, a guidance that requires the clinical trials to be run in populations that would mirror the treatment population that is envisaged for later on. But there's also other areas where ICH is very active, for example, on a guidance for how to include pregnant and breastfeeding women in clinical trials. So we have, provided our expertise and are very active in discussing these requirements that need to apply on a global level from our perspective to support innovation, to really enable us to run global trials and then ensure access, ideally, for populations around the world in a feasible and, the best possible way so that we are effective. And I just want to add that this is really where we see most, from our perspective, the policy levers are mentioned in the white paper that could be introduced. And we see a lot of opportunity and already a trajectory that's moving in the right direction. So happy to be here and to contribute also to the white paper. That was an honor. Thank you.
Thank you so much also for bringing this industry perspective. So Sanjana, turning to you now, how do we unlock innovation and what delivery systems do we need?
No, thanks very much, Katerina. It's a pleasure to be here today, and thank you for inviting me to the panel as well as to Path and, of course, the Global Alliance of Women's Health, which I've been involved in from the very beginning. I think my work at the Gates Foundation is really leading our policy advocacy piece, and we look at the entire spectrum from women's health and children's health. And the women's health innovation piece is a critical aspect of that work that I do. I do believe, that we've reached a stage that we are not just saying innovation in women's health is a moonshot of any kind. We are very much making incredible strides across the board. We've launched the white paper today, which is a great step forward. But I know there's so many tools, so many different innovations that have come out and have reached and are reaching the women who need them the most. For example, you've got the AI-powered ultrasound. You've got the next-gen contraceptives. There's a lot of work going on with low-cost diagnostics for STIs and sexually transmitted infections, for example. So there's a lot of work that's happening in terms of bringing together promising tools. But we all know and agree that you can't just do the innovation and have them stay as pilots in labs. You need to make sure they get out there and they're in systems that are actually designed with women and for women and keeping women in mind. One, I'd like to share an example. The foundation worked very closely with the National Institutes of Health and many partners, over 250 experts from across 50 countries that came together about 2 years back now in what was called the Innovation Equity Forum. And perhaps many colleagues sitting here might be members of the Innovation Equity Forum. That's a powerful forum bringing together the right experts in the ground. But what resulted as a result of that forum was an opportunity roadmap that actually identified 50 high-impact sort of areas on opportunities for accelerating women's health research and development that went right from data work to de-risking to new diagnostics to how do you really get those investment pathways to take things to scale. Today's report as well that was just shared by Amira, by Melanie and others, the policy work that is needed and the critical sort of recommendations in the policy paper are absolutely important to take things to scale. I do believe we're not really short on understanding the issue. We're getting there. We're short of really moving the needle and the ambition. We all need to do that. It's extraordinary that we're sitting in 2025 and we can say that only 4% of all the biopharma R&D work goes to really only female-specific conditions and 2% and only 2% outside of oncology. I mean, that's something, those statistics need to shift and change. So we have to bring that same level of ambition and energy to the women's health innovation ecosystem. And I would really strongly recommend this cannot happen if women are not included right from the very start. These should be women-led researchers, decision makers, users. You need to have that full arc. But lastly, the point to make here, when you look at it from an investment, from a funding, from a policy perspective, you need to bring all these different sectors and different, sort of expertise together to actually ensure that these innovations reach the women. So what would be really needed is bold action from leaders from across the philanthropic world, the private sector, the public sector. I see a representation of that on this panel and maybe going outside this room as well, so that you really create a strong ecosystem that is really supporting innovation to be incentivized, to be well-financed, and to be able to be delivered equitably at scale right from the start. So you have an end-to-end sort of view to this rather than doing it piecemeal.
So back to you, Charlotte. Speaking about money now, or actually coming to part two more broadly, how can we shift systems to enable inclusive innovation? So, question to you, Charlotte, how do we mobilize the resources that we need to fast-track innovation, but also to strengthen the R&D ecosystem?
I think it's a question I'll be getting a lot now that I'm at Wellcome is, how do you mobilize money? I think the first thing is that 7% figure is really shocking. And I think we should be making noise about it. What I've seen in all aspects, in part of my career, I worked a lot on violence against women and sort of getting evidence to increase that on the agenda. And a key part of it was getting the evidence, really understanding what you could do. But another point was bringing that evidence and making a noise. And that fundamental thing about the figure is really powerful. I didn't know it until I read this. And I'm somebody who cares about women's health, have throughout my career, but wasn't aware of that landscape. So I think there's a power of that figure that we should make some noise of. I think the second is just recognizing this. We aren't new. This isn't a new issue. All aspects of women's health have been underfunded. And if you just look back at, for example, the history of developing the oral contraceptive, it was a philanthropist, Mary McCormack, who put her inherited wealth into that we've all benefited from. That wasn't state-funded. Clearly developments have. But it took that to get something that we now take for granted and is phenomenally transformative. And I think it's just how do you bring that vision into actually why we need to do something and why people need to pool resource. So I think the second point then is just how do we leverage different groups that will support research funding or might be interested in investing in institutions and so on. And so that's the public, that's the private sector, it's the philanthropic sector. And we talk about public-private partnerships, but just how do we think about what that looks like in this space, which might bring slightly different combinations of players to the table. And then thirdly, and I think particularly for the private sector, because we need the innovation that they bring to this issue, is just how do we get the incentives right? And some of that is covered in the report. So, it might be tax relief, it might be other kinds of incentives like pharma market entry commitments and things like that. But just really thinking about how do you get the incentives so that they all pull you in the right direction of bringing more resource into this.
So Christine, on that note, turning back to you from your experience, what are the top regulatory shifts we need to ensure inclusive clinical trial design? And how do we make sure we generate the right data and close this research gap? I'm premenopausal myself, terrible symptoms. I understand I'm one of those groups who doesn't make it in your clinical trial. So how do we change this?
Yeah, that's really an important question. And I think what's from a R&D person, I'm part of R&D in the company, it's really important to understand, again, those regulations that are out there. Some of them have been around for 20, 30 or more years, and we need to look at the best way to update things. We need to include women in clinical trials. Of course, we need to do the right toxicology testing, and we may want to leverage new approaches like AI, which is not there yet, but we need to work on it to support us to have better models than the ones that we have been using for decades, to really make the pharmacology and pharmacodynamic data more telling, to understand what's the difference, sex-based differences between men and women. For example, for dosing, what's the right dose for a woman could be totally different, and we have to look into this as a sponsor of trials to get the dosing right for women. And these are the kind of regulations that, again, need to be agreed with the regulators around the globe. So it's accepted, and this is what needs to be done in a certain sequence, because it doesn't help if one major region has a different approach than the other. That's why I mentioned ICH, for example, where things are moving, but slowly sometimes. So let's make sure that this is prioritized, the topic, to really get the right innovation into also the drug development process and research processes. I hope that this is at least part of an answer. And there will, of course, be many aspects that we need to consider, for example, in terms of feasibility of requirements. If you think of orphan drugs that were mentioned by Namira, where we have incentives that are very effectful. Now there's more research done, not enough, but more than maybe 10, 20 years ago in the orphan space. But there we have very few patients. So it's really a challenge to find, patients anywhere around the globe and to get enough patients together so that the clinical trial results can be meaningful. In those areas, it's really a challenge to then try to mimic, sex or ethnicity requirements. That's really too small of a population. Then there are very big populations where you have trials with thousands of people. There it's, again, easier to do this. But in the middle, that's where the challenge comes, right? Where you do smaller trials, and that's where we really, from an industry perspective, it's very important for us to be able to do things in a speedy manner so that, we are pragmatic, we do what we can, but we speak to regulators again to find the right way and get those medications to patients as fast as possible.
So now I would like to turn to Jabulile Makanya, South Africa. Chief Nursing and Midwifery Officer, and we all know that your delegation is very busy, and I'm sure you're invited to many sessions. And so I was intending to explore with you cervical cancer, but I think instead, I'll ask you first a broader question about how can we leverage the G20 and the platform that you lead this year to drive a difference in women's health. And related to that, what are your thoughts on the white paper? And when you reflect on that, what resonates with you?
Good afternoon, colleagues. My apologies for being late. I was also in a different event. Excellencies, distinguished guests, esteemed partners, ladies and gentlemen, it's my honor to stand in for our Deputy Minister of Health, who on short notice had to be called to a different event. And just reflecting on our experience that we have had as a country broadly in co-hosting the G20, we've had privileges of participating into 2 G20 events, one accelerating UHC through primary healthcare programs, and it was in that space that as a country we're able to really showcase the very dimensions of primary healthcare from education, from our education, health professional education perspective, which is primary healthcare oriented and actually aligned to the burden of disease, making sure that all communities have access to health services, at least within the defined radius of less than 5 kilometers. And again, the emphasis was on preventive and promotive healthcare services, particularly on women's health. And around that, there are a number of programs that we are showcasing, particularly the midwife-led obstetric unit that actually contributes to the reduction of maternal mortality by making sure that within every district there are units that are led by midwives who have competencies of conducting normal deliveries, make timely referral where there are indications for the next level of care. And I think around maternal mortality, there were a number of examples around pandemic preparedness, our experience around management of COVID-19 and the role of community health workers, the role of partnership, community engagement at the various levels of accelerating access to healthcare were some of the examples that were showcased at that level. And secondly, in terms of working together for health, again, we looked at the broader health workforce strategies that would really be able to ensure that we are able to build a health workforce that is able to contend and create a resilient health system in the fight, in the light of the new epidemics, and again, particularly new epidemics and climate change, which poses different range of challenges, particularly in our case, the outbreaks on waterborne diseases that really are, that emanates from floods in some of the provinces that we have had, and that on its own really required a lot of new competencies to be able to contend with those kinds of challenges that are brought about by the impact of climate change on the health system.
Yeah. Thank you so much for these thoughts and also for bringing it back to these very practical topics, right? And including we as WHO, after decades of improvements, do see a flatlining of maternal mortality, right? And so to us, this panel is also so important because we have to break through and drive progress again in this area. So we've already talked a little bit about political momentum and partnership. Let's now, in the third part of this panel, dive into these aspects a bit more. So Mary, over to you. In your opinion, how can we structure partnerships across public institutions, private industry, and the global platforms that we've already touched upon to accelerate the inclusive innovation we need?
Thank you very much for that question. And indeed, structuring effective partnerships across public institutions, private industry, and global platforms is very vital for the acceleration of inclusive innovation and delivery. And to start off is, one, people must be able to establish very clear shared vision and goals. Because if we define these common objectives, then such as improving health, equity, expanding access, or even accelerating innovation, then this development of a shared vision must align to the interest of all the stakeholders. Secondly is creation of formal frameworks and governance structures that maybe countries should be able to set up multi-stakeholder platforms like councils, committees that have clear roles and decision-making authority using MOUs possibly that can bring the stakeholders together. It is very important equally to promote inclusivity and transparent engagement because this will ensure representation from the marginalized communities, probably, the civil society, the diverse sectors, So fostering an open dialogue, again, will bring trust among all the partners and everybody at play. It is very important to leverage on complementary strengths. And I want to give a powerful example in Kenya, where we have a kind of partnership that is unfolding right now, together with the PATH, Penda Health, is a Kenya-based healthcare provider, and Kenya Pediatric Research Consortium and the University of Birmingham. We are leading the world's first phase 3 randomized controlled trial of a large language model to support clinical decision-making in primary care. And if you look at this, it's a collaboration. When you talk about public institutions, they'll provide you with regulation, support, policy framework, and access to population. When you talk about private industry, they'll offer you with innovation, technology, and scalability of the same. And when you get to the global platforms again, they'll bring you expertise funding and maybe best practices from across the world. Therefore, these are just but a few. I can talk about alignment to funding and incentives, implementing data sharing and learning platforms, building capacity and sustainable engagement, advocacy. But there are also risks of not doing this. If you look at fragmented efforts that are all over and duplication, we need to pull resources together. Let us not exclude marginalized groups. We may have wasted resources and missed opportunities on innovation if we fail to do this. Therefore, in my submission, I would like to say that effective partnership and structures are built on shared goals, transparency, complementary strengths, and sustained engagement, driving inclusive innovation from concept to widespread impact.
Thank you so much, Mary, also for this very concrete lived example, very helpful. So, Sanjana, you seem to be very aligned with Mary, but do you have anything that you'd like to complement?
Well, yes, thank you, Mary, and completely aligned. Just a couple of thoughts from my side. I mean, it's very clear that no single sector can really, close the women's health gap. We need to, as you rightly said, bring in the different partners, but we also need new public-private philanthropic partnerships that can, or models that can really unlock the capital, de-risk the early stage innovation work that we want to do, and really ensure that our delivery systems reach the woman in every setting, whether you're looking at a very rural, hard-to-reach setting or you're looking at an urban setting. And I guess just building on what Mary said, the structuring of these partnerships and how they play to the strengths of each individual contributor while actually helping everyone sort of operate in sync, in tandem, in a concert fashion, rather than any kind of competitiveness, which I think Mary mentioned as well. There's also really a need for avoiding any duplication and redundancy, because you don't want to, you have limited resources, and you want to make sure that you're really not just partnering for the sake of the partnership, but you're grounding that partnership in very clear, discrete objectives that are complementary to each other's, but also to the efforts around the larger ecosystem. So in that way, and I want to really call out in some ways the work that we've done with the Global Alliance for Women's Health, which is a great example of this kind of collaboration and action, where you're bringing together a multitude of different stakeholders that are not only looking at the moral case for doing this work, but the economic case, the scientific case, but actually creating a platform for coordinated action, which is really data-driven, anchored in evidence, driven by the sort of principle of equity, and focused on getting the tools to the women who need them the most. I have a colleague in the audience who's here to actually help launch the Global Diagnostics Coalition. That is also a partnership to build on implementing the World Health Resolution on strengthening diagnostic capacity. And again, very critical that we develop those low-cost diagnostic tools for women in various settings and strengthen the women's health R&D ecosystem to take care of the diagnostic side too. Just want to end by saying, I think we've spoken so much about the partnership piece and others, but what we have in women's health and the work that we can do, it's really a universal accelerator. It's something you invest in women, you invest in families and communities and economies. And that is a very powerful advocacy sort of tool, to say it. And I think Amira mentioned it, but I want to say it again. Every $1 that you invest in women's health actually gives you a $3 return. And so this is a powerful way of really reaching a very diverse set of audiences, rather than just committed people or people working in this space, because you want to make sure you get new sort of partners here. So it's really about the power in how you use this knowledge, how you leverage this knowledge to spur even more innovation in this space, to inform the investments that are happening, to be able to advocate effectively and actually bring new allies into this, because that's the only way we'll be able to get that multiplier effect that we want for investments in women's health innovation.
Absolutely. Thank you so much. And, from WHO's perspective, I cannot say how important these partnerships are to us to drive progress. Sure. Mm-hmm. So perhaps just to give a quick, also practical flavor again to this, Melanie, cervical cancer is an area at the same time of underinvestment, but also an area where I feel we've made, and many countries have made enormous progress. So would like to because I understand we run out of time, very briefly your thoughts on this, and then I come to the closing question for each of you.
Thank you. Yes. I mean, I think cervical cancer is really the test case here for making progress in women's health. And I've said before, there are highly effective vaccines, screening, diagnostics, so there's no reason why we cannot reach the elimination goals. And we've made progress in innovation recently. A long time ago, there was a group of women who received a single dose of vaccine, and someone had the foresight to follow them up long term. And what was found was just with a single dose of HPV vaccine, it's as effective as a multi-dose regimen. And PATH has been really proud to be part of producing the clinical trial data to allow the policy recommendations for moving to one-dose HPV vaccine, which clearly gives much more access to the countries who need it at a much more affordable price to really be part of cervical cancer elimination. I think the other key point is to make sure that cervical cancer is part of primary health care. It's really integrated into immunization through the HIV, through non-communicable diseases, and it all should come together. And just to highlight that also through the Alliance, Global Alliance for Women's Health, there is the Breast and Cervical Cancer Coalition, which is really looking at how to deliver vaccines and diagnostics properly into care. So we're making fantastic progress, and I think this is, as I say, the test case and probably should be used for many other interventions.
So now my question to all of you is, what is the one concrete commitment the global community, all of us jointly here, must make this year to shift how we approach women's health science and innovation? So the one concrete commitment, and would love to hear in a very concise, crisp way, if we had a magic wand, what do we need to achieve? Do you have any volunteers? Would you like to start? Over to you, Jabulile.
Thanks. I think for me, the commitment is to invest. If there's a deliberate effort to really invest in women and looking into increasing funding for women's health, we need to collectively advocate for additional public-private investment in clinical and translational research. As colleagues have really shared, HPV vaccination is a case in point that has really made a difference in terms of cancer prevention amongst young girls, and South Africa has also benefited from that intervention. And we also really, in the light of dwindling financial resource and shifting funding interest globally, we need to look into how do we unlock a local economic potential, emphasizing that investment in women's health yield significant returns for both individuals and also making a global a difference at a global platform. Thank you.
Absolutely. Let's give that a round of applause. We all agree. Over to you, Mary.
I would say that one concrete commitment to the global community that we must make this year is to ensure that we establish a fund that is dedicated to multi-stakeholder women's health. And this kind of innovation fund that explicitly is dedicated to support research, is dedicated to support development, dedicated to support the deployment of women-centered health technologies, products, and services. If we can do that, I am telling you, the health of the women in our countries and our nations is going to be at the center stage of even any political statements that will be made from those nations. So in essence, a dedicated Women's Health Innovation Fund would serve as a tangible, high-impact step towards mainstreaming women's health and fostering transformational innovations that are aligned to global health priorities. Thank you.
Let's hope the donors in this room take you up on this. So, Charlotte.
The other figure I'm shocked about is the degree to which we aren't even disaggregating data by sex, right? I mean, it's unbelievable, unbelievable. And so I think there's something about just requiring that. Anybody who has the power to require that requires that. That's what I'm going to take back. WHO should require it. I mean, I think there's a lot of, and by age as well, maybe. But there's some things that don't actually cost money, and we should just get on with and do it, and ask for it. And people in position of power to ask for it and say, I don't want to see the aggregate. I want to see the disaggregated data. I want to look. Those questions aren't asked enough as routine as we try and understand any issue. So that for me is one. I think linked to that as well, I think at Wellcome, I think we'd be very interested in being part of conversations around women's participation in trials. And I think there's sort of, where is it straightforward? Where is it other regulatory complexities? What are those conversations that are happening? Where, what are the issues around trials of pregnant women or so on? So, I think we'd be interested in sort of actually what is the kind of technical conversations that need to happen to try and think about how to move forward on that. And then lastly, I think we should be paying attention to the ecosystem about research on women. I can think about lots of centres of excellence around the world where I can go if I want to get advice on malaria, or if I want to get advice on some other disease, but I don't know where I would go. I would know a few places, but paying attention to those centres of excellence on research for women's health, and some of the sort of issues that we're coming up in terms of the gaps. And I just think it's paying attention to that ecosystem and how actually, if we are bringing more money into this area, how do we not only strengthen and make sure we're getting studies, but also using that to build up that fundamental ecosystem that's so important ultimately for this agenda to sustain.
These were three commitments, and I can say from WHO's perspective, we are actually getting measured every year as through the UN SWAP tool in terms of whether we have disaggregated gender and sex data from trials, right? And we need to get better at that, fully agree. Christine, over to you.
Very challenging to go after distinct panel that has also a lot of lever compared to what I can do personally. But that's where I was going with my conclusion. I think we all have to contribute where we can. We all have a role to play, and we have to collaborate or at least, work together like we did for the white paper and find the areas where our contribution would make most of an impact. So that's what I would say. Thank you.
For me, it's being very intentional and informed in this acceleration that we want to do for women's health innovation. Intentional in understanding the data and then using that data, because we have so much of data. So I think it puts a responsibility to really be able to use our voice collectively with that data that we have. But sort of intentional in the investments, in making sure that we are prioritizing those investments that are really impactful and can be taken to scale for the women on the ground. And last but not the least, but really being intentional in participation of women at all levels, whether it's at the women researchers, the decision makers, the policy makers, but the women on the ground, the people that are actually where you're looking to have the maximum impact. So intention is very critical.
I fully agree with everything that has been said. I am a data freak myself, so data, metrics, and transparency, I think, are key things that you can pull a lot under. The sex disaggregated data, a long time ago, journals suddenly insisted that you had to put your clinical trial on a registry, otherwise they would not publish your data. Journals should be saying, we will not publish your data unless you do sex disaggregation. You can learn so much from that for future research and learn how best to make products for the people you're serving. Metrics, financial metrics, we all want a finance fund. So following the metrics for financing is a good indicator as to how well we are doing. And metrics for policy frameworks. So it's all data, metrics, and transparency for me.
It's now my pleasure to first of all thank you, all our speakers here, for this panel, for your insights, for the diversity of perspective and opinion. I think we are all aligned around a shared mission, but we need to now drive progress. We've heard today how important it is, to have decision makers at the table, to use the policy levers. We need national ownership. We need cross-ministerial collaboration. We need alignment and partnership with global platforms like the African Union, like the European Commission, the World Health Assembly, the G20, and let's not forget about the Sustainable Development Goals. There's a lot of very concrete progress we can make. I want to thank the more than 45 organizations who have contributed to this white paper, coordinated by the WEF. I do believe this white paper can make a difference, so let's work together that it makes a difference. Frankly, the agenda is ready, the evidence is clear, and the partnerships are forming. So what comes next, what comes now is action, and I thank you for helping us along. Thank you.